Caring for aging parents can be both emotionally and financially challenging, but with the right planning, you can manage these responsibilities without feeling overwhelmed. In this video, we'll guide you through strategies to manage the financial aspects of caregiving, covering budgeting, healthcare costs, legal considerations, and potential support options to help protect your parents and your financial future. Whether you're just beginning this journey or looking for ways to improve your plan, we've got you covered. Caring for aging parents involves several major expenses, and understanding them is crucial for proper planning. Let's break them down. First, healthcare costs. This includes doctor visits, medications, and hospital stays. Long-term care, like nursing homes or in-home caregiving, can escalate to thousands of dollars per month. Next are living expenses. Housing costs vary depending on your parents' living situation, whether they move into a nursing home, assisted living facility, or stay in their own home with modifications. Don't forget daily living expenses, like food, utilities, and transportation. Then there's insurance and medication. While health insurance can help cover some costs, there will likely be out-of-pocket expenses for prescription drugs, specialized treatments, or supplementary insurance plans. Finally, plan for unexpected expenses. Medical emergencies, sudden health crises, or the need for home modifications like installing ramps or safety equipment can add additional financial strain. Building an emergency fund is crucial to avoiding financial surprises. Once you understand the costs, the next step is to create a caregiving budget to get a clear picture of costs. Determine their income sources, such as pensions, social security, or retirement savings, and make a list of their current expenses. This will give you a clearer picture of what's available and what's needed. If possible, consider shared costs. Dividing caregiving expenses among siblings or other family members can help lighten the financial burden and ensure that everyone is contributing to your parents' care. Next, consider establishing a caregiving fund. By setting aside money each month, you can be better prepared to cover unexpected or ongoing expenses. It's important to revisit this budget regularly, as caregiving needs and costs often change over time. Adjusting the budget as necessary will help you stay on track. Legal and financial planning is a crucial part of caring for aging parents. By taking the right steps, you can ensure their wishes are respected and their finances are protected. First, consider assigning a power of attorney, POA. A POA allows someone to make financial and healthcare decisions on behalf of your parents if they're unable to do so themselves. This is important in managing their finances, paying bills, and making critical medical decisions. Without a POA, you may face legal hurdles that can delay important decisions during emergencies. For instance, when Sarah's father was hospitalized, having a power of attorney enabled her to make quick medical decisions without delay. Ensure that these legal documents are in place before a medical emergency arises. Next, ensure your parents have a living will or a comprehensive estate plan. A living will outlines their preferences for medical treatment if they are incapacitated, while an estate plan protects their assets and specifies how they want their estate to be distributed. Having these documents in place minimizes disputes and ensures their wishes are followed. Legal guardianship may be necessary if your parents can no longer manage their affairs due to illness or dementia. This court-appointed process can help safeguard their financial and personal well-being. Healthcare is one of the largest expenses when caring for aging parents. To navigate these costs, it's essential to understand key healthcare options and plan for out-of-pocket expenses. While public health insurance in many countries covers basic healthcare needs, long-term care is often not fully included or may have limited coverage. For example, John realized this when his mother moved into a nursing home. Fortunately, his family had long-term care insurance, which saved them from significant out-of-pocket expenses. If your parents have limited income, check for income-based healthcare assistance programs in your country. Many nations offer support for long-term care costs, including nursing homes and in-home care, for those who meet specific financial criteria. These programs can significantly reduce the burden of long-term care expenses. Consider long-term care insurance. This type of insurance helps cover the costs of assisted living, nursing homes, and in-home care. It can make a significant difference in covering these high costs over time. Lastly, plan for out-of-pocket costs. Even with insurance, there will be expenses for services like specialized therapies, prescription drugs, and some medical equipment. Budgeting for these unexpected costs is critical to ensuring your parents receive the care they need without overwhelming your finances. Financial assistance programs can help ease the burden of caring for aging parents, especially when costs start to add up. Let's explore a few options. First, there are several government programs. Many nations offer Social Security or pension schemes for seniors. Some provide additional support for low-income elderly, covering basic living expenses and healthcare costs. Look into your country's public health insurance or National Health Service. These often provide coverage for seniors, particularly for long-term care needs. If your parent served in the military, check for veteran-specific benefits. These may include healthcare, pensions, or assisted living support. There are also non-governmental resources. Charities and non-profits worldwide offer support for eldercare. Research local organizations specializing in senior care or specific health conditions. As a caregiver, you may also qualify for tax benefits. Many countries offer tax deductions or credits for caregivers. Check with your local tax authority about claiming a parent as a dependent or deducting caregiving expenses. It's important to explore these opportunities to maximize your financial relief. Talking about finances with aging parents can be a sensitive topic, but it's essential to have these conversations early to avoid misunderstandings later. Start by approaching the topic with sensitivity and respect. Frame the conversation around ensuring their well-being and financial security. Let them know you're there to help, and that planning ahead can prevent future stress and confusion. It's important to foster open communication. Ask about their financial situation, medical wishes, and any documents they already have in place. Knowing this information can help you make decisions when the time comes. Don't hesitate to involve siblings or other family members in the discussion. Sharing the responsibility of caregiving and decision-making can reduce the burden on one person and ensure everyone is on the same page. Managing the financial aspects of caring for aging parents can be overwhelming. The emotional and financial stress of caregiving can affect your own financial health and well-being. Set clear financial limits to protect your savings and retirement, which could include involving other family members to share the caregiving costs. Also, remember to seek support. Caregiving doesn't have to be done alone. Reach out to financial advisors, eldercare professionals, or support groups for advice on managing caregiving expenses. These resources can offer financial guidance and emotional support, helping you navigate this challenging time with more clarity and peace of mind. Managing the financial needs of aging parents can be challenging, but with careful planning, it's manageable. Let's recap the key points. First, create a caregiving budget to get a clear picture of costs. Then, ensure legal and financial plans, like power of attorney and estate plans, are in place. Make sure to understand healthcare costs, from public health insurance to private long-term care insurance, and explore financial assistance programs that may be available. Finally, don't forget to prioritize your own well-being and seek help when needed. Now is the time to take the first step. Start by creating a financial caregiving plan. Have open conversations with your parents and consult with a financial professional for guidance. Managing your parents' finances is challenging, but with planning, you can ensure they receive the care they need without straining your own finances.